we do help patient to battle with that too, and it's even where our roles becomes indispensable when it's come to pain, lymphedema, breathlessness, reduced range of motion, through which physiotherapists through careful assessment and evidence-based intervention. I I can say we help patients remain as active and independent as possible during treatment. Once treatment has been completed, our work also continues. It never stops. Cancer survivors often face long-term physical challenges that persist months or even years after treatment. Some develop shoulder dysfunction after breast cancer surgery, others continue struggling with generalized body fatigue, as I mentioned earlier. Some experience reduced bone density, muscle weakness, chronic pain, or cardiovascular complication, and so many other things. Our goal during the survivorship is to restore function, promote long-term health, also reduce future complications that may arise, and to help the individual return to meaningful participation in work, family, recreation, and also in the society at large. And then in the final stage, there is palliative care. Unfortunately, not every patient can be cured. However, every patient deserves dignity, every patient deserves comfort, every patient deserves the opportunity to move safely for as long as possible. So physiotherapy remains valuable even when cure is no longer possible. In palliative care, our priorities normally changes. Instead of restoring function, we focus on symptoms management, like maybe reducing the pain that is disturbing the patient, preventing fragile injuries, maintaining mobility, supporting caregivers, also improving comfort to the patient, preserving independence for as long as possible, helping patients continue doing the activities that matter most to them. Sometimes helping patients work independently to spend time with family is even one of the most greatest gifts we can offer at some time. That is oncology physiotherapy. It is holistic. It is patient-centered. It is evidence-based. Above all, it recognizes that behind every diagnosis is a human with dreams, responsibilities, fear, and also hope, and also, of course, family and loved ones. We do not simply treat cancer, we care for the person living with the cancer. Dr. Waguda, we can move up to the next slide. Hello, Waguda. Am I audible? Hello, Cynthia. Is the slide visible?
The slide is not visible.
The slide is not visible.
What is going on, Waguda?
Let me get reach him.
Let me share again.
Okay. Share screen again. I think still I'm not seeing this. Okay, I can see the slide now. I think we are going to slide 5, right?
Yeah.
like the advanced role of the oncology physiotherapist. Okay. Yes.
Yeah.
Yes. Yes. The advanced role of oncology physiotherapist. Now that we understand what oncology physiotherapy is, let us uh, take a closer look at the unique role we play within the multidisciplinary team, right? One of the greatest misconception about physiotherapy is the belief that our work simply involves prescribing exercise and dose doing and also adding maybe a few things. If that were true, almost anyone could do the job or some other people can take over the job. But that is not what defines physiotherapy. What defines us is clinical reasoning. Clinical reasoning is the ability to assess patient comprehensively and also interpret clinical findings, identify impairments, anticipate risks, and design an individualized management plan based on the best available evidence on the ground. Every intervention we prescribe, we must have a reason behind it. Every decision we make, we must have evidence behind it. And every patient requires an individualized approach, different from any other patient. This is why assessment is the foundation of oncology physiotherapy. Before prescribing any intervention, we first ask ourselves several important questions. What type of cancer does this patient have? Like what stage is the disease? What treatment are they receiving? Have they undergone surgery? Did they have bone metastasis? And uh, are there precautions that should influence treatment? Are there contraindications to exercise? What symptoms are limiting their function? Only after answering these questions that we can safely plan rehabilitation for each particular patient. A comprehensive physiotherapy assessment may include posture analysis, range of motion assessment, using goniometry, muscle strength testing, balance assessment, uh, gait analysis, and also, of course, cardiopulmonary evaluation, functional mobility testing, and fatigue assessment, and so many cancer patients is something that they will be battling with generalized body fatigue, and also assessing of quality of life, and also pain assessment, of course, neurological examination, and the lymphedema evaluation. Each component provides valuable information that guide our clinical decision. Assessment is not something we perform once, it is an ongoing process. Every treatment session provides new information. As patient improves, our goals evolve. If complication arises, then we modify our intervention accordingly. That is what evidence-based practice looks like. Beyond assessment, also oncology physiotherapists utilize numerous specialized interventions for patients with the lymphedema. There are treatment like complete decongestive therapy, which will be covered in this part of the webinar by Dr. Yusuf. For people experiencing fatigue, we normally, the oncology physiotherapist normally prescribe and exercise programs for individuals
Dr. Adamu, we cannot hear you. You are not audible. Guys, let's wait for Adamu to fix network. Adamu, can you hear me? As we wait for Adamu to fix his network, maybe I can continue sharing the notes. Dr. Stella, Cynthia,
Hello, let me try to reach out to Adamu. No, Cinda should reach out to him since they're in the same country.
okay. Guys, hold on. We are fixing the network issue. Thank you very much for joining today's webinars. I hope you are learning quite well. I hope you are taking notes. Yeah, I can still continue sharing the notes. Let me share the notes again. Cynthia, when or Stella, when Adamu is ready, kindly inform me. I'll share the notes again. I hope the notes are visible. I hope they are visible by now. We started with the introduction to oncology, rules, scope, and impact on cancer care. So we dealt with understanding cancer, oncology, physiotherapy definition, advanced role of physiotherapists, the assessment, intervention, collaboration. I think we were there. Then there is rehabilitation and rehabilitation journey. From rehabilitation to palliative care, evidence and best practices. We can go back understanding cancer types, causes. It's good to understand the cancer, the types, and the causes before you manage a cancer patient. Cancer is not one disease, it's a group of diseases in which abnormal malignant cells divide without order or control. Yeah, by now I can see Adamu. Mister, Yeah, I hope he is fixing his network. Yeah. Then we went to what is oncology. We defined what is oncology. It's a specialized branch of physiotherapy focused on assessment, treatment, and rehabilitation of individuals affected by cancer across the entire disease trajectory. In case you missed this part, what is oncology, physiotherapy? There's a pre-rehabilitation, optimized before treatment, then active treatment during chemo, radiation, or surgery. Yeah, survivorship, post-treatment recovery, then there's palliative care. Yeah, it's good to understand those steps. Then we went to the advanced role of oncology physiotherapist. Beyond basic exercise, we are movement specialists, symptoms managers, and rehabilitation experts in oncology. You must do the assessment, postural analysis, the range of motion of joints, the strength, function capacity, lymphedema staging, fatigue stage and types, guide precautions. When you are advanced physiotherapist in oncology, it's good to do comprehensive assessment. Also specialized techniques, complete decongestive therapy, manual therapy, breathing exercises, progressive resistance, aerobic training tailored to cancer type. I work with oncologists, surgeons, nurses, and palliative. Um, Also during intervention planning, use clinical reasoning. Um, for me, I had a cancer patient like 2 weeks ago, so I understand the progression of cancer and management somehow. Yeah, although I have not dealt with so many patients of cancer, but I have encountered uh, some during my during my work. Can you hear me, Stella?
Yes, I can hear you.
Okay. Yeah, uh, we can continue. If you don't hear me, kindly let me know on the messages. Yeah, let me know. Uh, then after intervention planning, uh, there's
Obura, there is echo.
this echo.
Yes.
Okay, let me mute on one side. And now it's fine.
Hello,
Not yet.
hello,
Yeah, Adamu.
hello.
Yeah,
Hi,
we can hear
can
you.
you all hear me?
Yeah, we can hear you.
Hello.
Yeah, Adamu.
We can hear you, sir.
Yes.
Hello, hello, hello,
Yeah, welcome back.
hello.
Adamu, welcome back.
Yes, so much. Thank you so much. Thank you so much. Can you? Like, can you all hear me?
Yes, we can hear you.
Okay, as I was saying, collaboration is equally important. I was talking about caregivers before the network issue. So, no single profession can address every aspect of cancer care. We work alongside oncologists, the medical doctors, of course, the nurses, occupational therapists, dietitians, psychologists, speech and language therapists, social workers, pharmacists, uh, and also the family members, the caregivers that I mentioned. Every profession contributes unique to his expertise to this population of patients. As physiotherapists, our expertise is movement, function, exercise, and quality of life. When rehabilitation is targeted early into cancer care, patients experience better physical function, fewer complications, improved treatment tolerance, and also shorter hospital stay, of course, because the prognosis is going to be a good one, and also enhance quality of life in general. This is why oncology physiotherapy should never be viewed as an optional service. It is an essential component of comprehensive cancer care. Now, Dr. Wagura, we can move to the next slide, please. The next slide. Can you all see the slide?
Oh,
Hello?
yes, we can
Yes,
see
we
the
can
slide.
see.
Okay. We can continue then. Rehabilitation across the entire cancer journey. One of the greatest strengths of oncology physiotherapists is that rehabilitation does not begin after treatment. As I mentioned earlier, rehabilitation begins the moment patient is diagnosed with cancer. In fact, rehabilitation should accompany the patient throughout every phase of the disease. Okay, let us briefly walk through that journey together. The first phase is pre-rehabilitation. Uh, Many of us may ask, why should we rehabilitate someone before they have even started treatment? And I think the answer is simple. Patient should enter treatment stronger, generally recover better, and also cancer treatment such as surgery, chemotherapy, radiotherapy place tremendous stress on the body. If we improve physical fitness, hello,
We can hear you.
okay. Am I audible?
Yes, you are.
Okay, okay, okay. If we uh, if we improve patients' physical fitness and we increase their psychological reserve and improve their ability to tolerate treatment, during pre-rehabilitation, physiotherapists assess baseline function of the patient. Uh, we identify impairment, optimize respiratory functions where necessary, and also improve muscle strength and cardiovascular endurance. Also, we educate patients about post-operative exercises and prepare them physically and also psychologically of what lies after the surgery. That is what lies ahead, something that they should expect. Evidence also suggests that well-diagnosed, patients that are diagnosed when put through pre-rehabilitation programs, it can reduce post-operative complications. It can shorten hospital stay, improve functional recovery, and enhance quality of life of the patient in general. The next phase is the rehabilitation, which is during active treatment. Many patients believe they should stop all physical activity during chemotherapy or radiotherapy, while some treatment days require additional rest. Prolonged inactivity usually lead to further weakness and also deconditioning. Our goal is there to keep patient moving safely during the treatment period. We help them manage fatigue, as I say, side effect of is one of the side effects of chemotherapy, which is generalized body fatigue. We also help the patient to maintain muscle strength, improve balance, reduce treatment related complications, prevent functional decline, and support also independence. We also maintain participation in meaningful activities. Uh, Exercise prescription during this stage are carefully individualized, as I say, based on treatment type, uh, some lab investigation, the stage of the disease, and also overall patient medical condition. Once treatment has been completed, patient will enter the survivorship phase. Fortunately, advances in cancer treatment mean that more people are surviving cancer than ever before. However, surviving cancer does not always mean returning immediately to previous levels of health. Many survivors continue to experience uh, body fatigue, weakness, pain, reduced cardiovascular fitness, uh, and some will even battle with osteoporosis, neuropathy, reduced shoulder mobility, cognitive difficulties, anxiety, depression, and also some of the patients usually live with fear of reoccurrence, thinking that maybe the cancer will be back or some sort of that kind. This is where physiotherapy uh, continues to make enormous impact throughout all the phases. Our objective now will shift in the survivorship toward restoring long-term physical function, also promoting healthy lifestyle, preventing future complication, supporting return to work, and also encouraging lifelong physical activity and improving overall quality of life. Then finally, we reach the palliative rehabilitation. Sometimes rehabilitation is misunderstood in this concept. When people often assume that rehabilitation only aims to restore full independence, but rehabilitation is equally valuable when cure is no longer possible. Our goals simply change. We focus on comfort, pain relief, safe mobility, maintaining dignity, preventing complication, supporting caregivers, preserving meaningful activities, helping patients remain as independent as possible for as long as possible. Sometimes success is helping patients continue attending family gathering. Sometimes it is enabling them to walk independently to the bathroom. Sometimes it is simply reducing pain enough for them to sleep comfortably. This achievement may appear small to others. To oncology patient, the patient with cancer, they, this can mean everything to them. Like it can mean the world. This illustrates one of the most beautiful aspects of oncology physiotherapy. Like the physiotherapist did not simply follow patients through one stage of treatment, they accompany them throughout their entire journey. Wagura, we can move up to the next slide. Can you all see the slide?
Yes, we can see the slide.
Yes, we can see it.
Okay. The evidence-based practice in oncology physiotherapy. Everything we have discussed today raises an important question on How do we know this intervention actually work? The answer is evidence, right? Modern healthcare demand that every clinical decision uh, that is made should be supported by the best available scientific evidence, combined with also combined with our clinical expertise and also patients' goal and preference. This is what we call evidence-based practice. Evidence-based practice is not about replacing clinical experience. Uh, no, it is about following research blindly. It is about integrating three important components: the best available research evidence, uh, the professional knowledge and clinical judgment, and the and also the individual values, needs, and circumstances of each patient. When these three components come together, patient care improves. Fortunately, oncology physiotherapy is one of the fastest growing areas of rehabilitation research. Over the past 2 decades, hundreds of high-quality clinical trials, systemic reviews, and international guidelines have demonstrated the effectiveness of physiotherapy intervention across cancer treatment. For example, exercise is now strongly recommended by major international organizations for most people living with and also beyond cancer. Research also constantly shows that appropriately prescribed exercise reduces cancer-related fatigue and also improve cardiovascular fitness, increase muscle strength, and enhances quality of life. It also reduces anxiety and depression. It improves physical function and help patients to tolerate treatment more effectively. Similarly, research supports the role of pre-rehabilitation in improving post-operative outcomes and reducing complications. Evidence also demonstrates that what I have mentioned earlier in the management of lymphedema, which is CDT, which will be covered by Yusuf, complete diagnostic therapy, it remains the gold standard intervention for cancer-related lymphedema. These findings reinforce an important message, which is physiotherapy is no longer viewed as supportive care alone. It is recognized as an essential component of comprehensive cancer management. However, evidence-based practice also requires lifelong learning. We should keep reading on daily basis, keep learning, because the healthcare will continue to evolve. New treatment techniques will emerge, new exercise guidelines are published on daily basis, new technologies are becoming available. As physiotherapists, we have professional responsibility to remain current. This means reading journals, attending conferences, and also participating in CPD programs, joining professional organizations, and also collaborating with colleagues. Also, a very important thing, engaging in research and critically appraising new evidence before incorporating it into practice. And also, here in Physio African Knowledge Group, this commitment to lifelong learning is one of our core values through our webinars, journal discussion, mentorship program, and so many other things. And just like this boot camp that we are doing, we hope to build a community of physiotherapists who are confident and competent, also curious and committed to excellence. Because ultimately, evidence-based practice is not about impressing colleagues with scientific knowledge, it's about improving patient outcome. Every article we read, every skill we learn, every guideline we apply, every course we attend, every discussion we have, it translates into better care of the patient who trust us with their lives. That is why learning never truly ends. As physiotherapists, we remain students throughout our careers, and that is lifelong pursuit of knowledge. And it's what will continue advancing oncology rehabilitation across Africa. Now that we have explained the scientific foundation of oncology physiotherapy, let us conclude by discussing the challenges we face within African context, the opportunities before us, and how each of us can contribute to shaping the future of cancer rehabilitation on our continent. Dr. Wabura, we can move to the next slide. Is the slide visible? Can anyone see the slide?
Yes.
Hello?
Yes.
Okay. You can all see the slide, right?
Yes, we can see the slide.
Oh, okay, okay. So now the challenges and the opportunities in our African context. Uh, Ladies and gentlemen, after discussing the science and clinical practice of oncology physiotherapy, I would like us to reflect on our own reality here in Africa. Everything we have discussed today is supported by strong scientific evidence. The challenge, however, is not always knowing what should be done. The challenge is often implementing within our healthcare system across Africa. Because across Africa, the burden of cancer is in continuous rise. Every year, thousands of people are diagnosed with breast cancer, prostate cancer, cervical cancer, colorectal cancer, lung cancer, and so many other types of cancer. But unfortunately, many patients present late, often when the disease has already reached an advanced stage. This happens for many reasons. One of the reasons could be limited awareness, financial constraint, and poor access to healthcare facilities, and also cultural beliefs. And some people have also fear of being diagnosed with the disease, and also shortage of specialized oncology services. As a result, many patients begin treatment only after the disease has progressed significantly. This reality presents enormous challenges for rehabilitation. Another challenge is the shortage of physiotherapists with specialized training in oncology rehabilitation. In many hospitals across Africa, oncology physiotherapy is either unavailable or poorly integrated into cancer care. Many physiotherapists graduate from universities having received only a brief introduction to oncology physiotherapy. Some receive no formal oncology training at all. Consequently, they may feel uncertain in managing patients with cancer. Questions such as, is it safe to exercise this patient? Can I mobilize someone with bone metastasis? How I assess lymphedema? When should rehabilitation begin? These uncertainties are common. This is exactly why educational programs like this boot camp are important. We also face resource limitation. Some facilities lack comprehension garments. Some have limited rehabilitation equipment. Others have not dedicated oncology. They don't have oncology units. So many hospitals, so many. In many hospitals, one physiotherapist may be responsible for dozens of patients every day. So these challenges are real. We should never pretend they do not exist. However, challenges should never become an excuse. Instead, they should become opportunities for innovation. Africa has something incredibly powerful. We have resilient healthcare professionals. We have passionate physiotherapists. We have talented young clinicians that are eager to learn. We have researchers asking important questions. We have educators committed to sharing knowledge. And above all, we have patients who deserve the very best care we can provide. This is why the future of oncology physiotherapy in Africa is so exciting. Every year, more physiotherapists are developing special interest in oncology. More universities are recognize the importance of cancer rehabilitation, and some hospitals are integrating physiotherapists into multidisciplinary oncology teams. Research output from Africa continues to grow. International collaboration are increasing. Technology now allow us to learn from experts across continent without leaving our home. We can learn virtually, like what we are doing right now. People from different countries, different cultures, different healthcare uh, are all learning together in one virtual classroom, like this boot camp that we are doing. This is exactly why the PCO Africa Hub exists. We recognize that waiting for change was not enough. We decided to become part of the change through webinars, mentorship program, research collaboration, journal discussion, professional networking, and educational boot camps like this one. We are creating opportunities for physiotherapists to continue learning long after graduation. Uh, Alhamdulillah, we have already built a growing family of physiotherapists across Africa. We believe that collaboration is stronger than competition. As I mentioned earlier, one of our major goals is obtaining official recognition by World Physiotherapy, which will allow our educational activities to offer CPD points, enabling participants to use those points toward annual license renewal in many countries. This milestone will strengthen the quality and the impact of our programs while ensuring they meet international standards. But our vision goes far beyond the CPD points. We envision a future where every physiotherapist in Africa has access to quality education, a future where oncology rehabilitation becomes a routine part of cancer care in every hospital, a future where patients can no longer have to travel hundreds of kilometers to access rehabilitation services. A future where African physiotherapists contribute groundbreaking research that influences global clinical practice. That future is possible, but it depends on us. Every one of us has a role to play here. Wagura, we can move on to the next slide. Am I audible? Can anyone, like, are you all seeing the slides?
Yes.
Okay. So now,
Yes.
call to action. As we gradually come to the end of today's lecture, I would like to leave you with a challenge. Knowledge is powerful, but knowledge alone changes nothing. It is the application of knowledge that transforms lives, right? Today you have learned about cancer biology, you have learned about oncology, physiotherapy, you have learned about so many things like evidence-based practice in cancer care. And now comes the most important question. What will you do with this knowledge when you return to your hospital? Will you assess your next patient with cancer? Will you confidently recommend exercise where appropriate and so many other things? Perhaps you begin by creating maybe more like a group that with people who have the same interest to be having discussion on timely basis, and also searching for programs like this one, so that we should all keep learning about the cancer management. I also encourage each of you of us to remain connected with the PCO Africa Knowledge Group, because this community was created for all of us. Participate in our webinars, join our journal clubs, contribute to research, volunteer as speakers, mentor younger physiotherapists, share your clinical experience, ask questions, build friendship across Africa. And networking is very, very important. We learn together, we grow together. Our patient also benefits from us, and when our patient benefit, our profession becomes stronger. Finally, I want to encourage those of you who have developed an interest in oncology physiotherapy to continue advancing your knowledge, read current research, attend conferences, pursue specialist training, seek mentorship, challenge yourself. Just never stop learning. Remember, cancer care is evolving rapidly. our knowledge must evolve with it. Thank you all for listening. As I conclude this opening session, I would like to express my heartfelt appreciation to uh, every one of you. Thank you for choosing to invest your time in learning. Thank you for believing in the vision of Physio Africa Knowledge Hub. Thank you for believing that physiotherapy has an essential role in improving cancer care across Africa. Today has not simply been a lecture, it has been the beginning of a journey. Uh, Over the coming weeks, we shall continue exploring important topics together. This is just more like an introduction to all of it. We shall learn from experienced clinicians. We shall discuss practical cases. We shall ask questions. We shall challenge one another. And together we shall become better. Before I finish, I would like to remember an important message. Cancer changes life, but cancer does not define a person's life. Behind every diagnosis is a father, mother, family member, someone with dreams, someone with fears, someone hoping for another opportunity. So, as physiotherapists, we have the privilege of working alongside them during one of the most difficult period of their times. Sometimes we restore movement, sometimes we restore strength, sometimes we restore confidence, and sometimes we simply provide hope. And sometimes hope is the most powerful intervention we can offer. So thank you all for listening. Thank you to the moderator and also all the listeners. Thank you.
Thank you very much, Mr. Adamu, for this wonderful presentation and you answered a lot. It's been a wonderful one. And I'll be opening the floor for questions. Any questions on presentation, have any input or contribution that you want to make so that we can move forward. So you can just unmute your mic or raise your hand so that you can ask your questions. Do you have any questions that we can move to the next stage?
Questions, suggestions, and also if you have any advices, you can also please unmute your mic and feel free to speak. We are all family here.
I hope everyone can hear me.
Yes, I'm hearing you.
My name is Dennis Lewis Mtenga. I'm from Uganda. And first of all, I want to appreciate the presenter tonight for the delivery of the good introductory message on oncology in physiotherapy. We really hope what is unfolding in the next weeks is going to be really great because we now believe a good foundation has been set with high expectations from I think everyone on call. Yeah, but my inquiry is one. Um, you see, such CPDs are really engaging, and in most cases, by the time we complete a specific topic, maybe for example, what we have just started today, oncology in physical therapy, you might see that someone has really gotten full knowledge they may not be as great as someone who has attended maybe a fellowship or class on that specific area, maybe had a postgraduate diploma in that specific field, but at least they have really good knowledge for them to engage with patients. So I was suggesting in form of a request to the administration that if possible, at the end of, for example, this um, kind of topic that we've taken on, maybe certificates can be given so that it is easier for me to go to maybe Uganda Cancer Institute or maybe the other device, and then I am applying, but then my application is made heavier by that certificate that I attained when I attended all the sessions under that specific topic. For example, the oncology and physical therapy. Yeah, that was my appeal or request to you. Thank you all.
I think we can respond to this.
Hello, Cynthia. Cynthia, are you there?
Yes,
Can I
yes,
respond? Like,
yes,
can I respond to what Dennis have just said?
yes, you
Okay,
can.
I think Dennis, I explained in while presenting, I have explained that we are working toward getting a recognition from World Physiotherapy, and that will enable us to be giving out CPDs, and that CPDs will be used anywhere, like when you're going to renew your license or when you're going to apply for some other programs. But nevertheless, we we are going to discuss on maybe giving out the certificate at the end of this webinar, but the certificate will not contain CPD points as we did not yet receive recognition from World Physiotherapy. So the CPD points will only be given after getting the recognition from World Physiotherapy. As of now, we can maybe only give out certificates. So I think that will also help, and someone might help it in the future or while trying to get into some other programs related to this one. Thank you.
Okay, thank you very much. Does anybody have any other thing to say? So I think I asked a question. My question is concerning how to pursue further knowledge and career as a physiotherapist in oncology. So you talked about maybe going for extra training and maybe obtaining a course on oncology. So is there any way we can know when maybe some of these institutes they are on their is there any way we can know when they have started registering for their training, or there anyone comment to us that we can okay go online register and we can join in their training to help us get more practical knowledge and experience about oncology physiotherapy?
Thank you very much, Cynthia, for the questions. Thing is, in Africa, we have little to even no oncology programs that, but what I can say is like the one that I did is a scholarship that I got from Cancer Exercise Specialist Institute, and also I will be sharing all things like this to the group so that people that are interested, when the registration period is open, they can apply for the scholarship, and it's something that you can get easily. So you can start with programs like this one. There is also other one from, I forgot the name of the program, but it is held in New Zealand. It's also a virtual something that someone can attend from comfort of his country. But also in the other aspect of becoming certified lymphedema therapist, I think Yusuf is going to speak about that one because he's part of one of the schools uh, that are training physiotherapists to become certified lymphedema therapist. Is Gütleg School of Lymphology in Germany. So Dr. Yusuf is part of the school, and when the time that he's going to make the presentation comes, he's going to make it clear on how you can join the programs, how you can become a certified lymphedema therapist, and so many other things. And also for some people that wanted to maybe pursue the career outside Nigeria, you can do your residency, like physiotherapy residency in oncology physiotherapy. It is called Oncology Clinical Specialty, which is OCS. You can get that OCS after graduating from the course, which will be added to your name. And also, you can continue and keep growing from there. Thank you.
Okay, thank you very much, Mr. Adamu. Please, is there any other person that has any question or input? If someone asks a question on the message, going forward, is there any WhatsApp group where we can receive updates? Yes, a phone number has been sent, so you can reach out to the number. And also, there is a WhatsApp group. You can be added to the WhatsApp group to receive more information, and you can stay updated with what we are having. Um, I also want to recognize and acknowledge the leaders of Physio Africa Knowledge Hub that are present with us. We have PC Wagura, we also have PC Compass, they are social media managers. We also have PC Frank, who is here with us. Um, Dr. Stella is present, one of the co-founders. So we want to really acknowledge their presence with us here before we move forward, and every other leader that's present, and we see what you do and your contribution to the community, and we want to encourage you to keep it up. So we'll just have like next 5 minutes. If there's no other question, we'll just go.
Hello, Cynthia. I think because there is no any other question or comments, I think you can conclude the today's lecture. Okay. Dr. Davidson want to speak, please. Sir, the floor is yours.
Okay, thank you, Adamu Aliyu, and all the great leaders that has put this educational platform together for the benefit of African physiotherapists, more especially in area of oncology, which is still evolving, more so in Africa, where you don't have much specialized training in this area, and which some country curricula does not even capture oncology and palliative care physiotherapy in their undergraduate study. whereas the burden of oncology care and rehabilitation is on increase. So this is one of the noble developments of platforms in Africa to bridge the gap in practice for physiotherapists who wish to take a career in this area. So this is not only educational but also awareness in African continents, and it's very much welcome. I just want to say thank you because oncology, physiotherapy, and palliative care, it's very vital, most at this point in time. And I will give you all the support that you need so that we'll carry this campaign as far as we can go in making sure that Africa will have a united front as far as oncology and political physiotherapy is concerned. Thank you very much. Just to show appreciation to what you guys has put together, we're there and we'll give it a support and a push. Thank you very much. Of course, I will make the World Physiotherapy IPT Hope International Physiotherapy for HIV, oncology, and palliative care to know about these developments. They will know about it and give recognition in due course on it because it's noble. Of course, I'm a chair in hospice and palliative care in IPT Hope, so it's very much welcome. Thank you.
Thank you very much, Davidson, for this great input. We really appreciate. So the close of today's presentation, and we'll be calling on Dr. Stella to give us a closing remark. I think someone is raising up. Okay. Okay. Davidson, you can unmute your mic. You're raising up your hand.
Good evening, everyone. Thank you so much, Dr. Adamu, for the insightful session. And huge gratitude to everyone for joining this webinar. Kindly share your email to Agora for you to receive the slides. Also, another thing, a reminder, we'll be having our next webinar on 17th, led by Dr. Cynthia. Sorry, Dr. Cynthia. If you're not part of the Phys Africa Knowledge Hub group, kindly at Wagura or Kumpash, kindly share the link. Yes, that's how we will be sharing the link to join the webinar. Yes, thank you so much and have a great evening.
Thank you so much, everyone. Have a great evening. Thank you for joining, sir. It's good to have you here. Thank you, sir. Thank you.
Thank you, everyone. We have come to the close of today's end of today's presentation. See you all on 17th, same time, same venue. So Agura will be available for any other information to join the WhatsApp group, join our WhatsApp channel, and also other platforms. You can follow us on TikTok and other social media to keep yourself updated. Have a nice evening.
Umba.